Okay, if you're a parent in South Africa, I'm willing to bet your WhatsApp groups have been absolutely buzzing about meningitis lately, right? There's all this talk about outbreaks, vaccines, the costs, and it can all feel pretty overwhelming. So today, we're going to cut right through all that noise and give you a clear, fact-based look at what's really going on. Let's just get straight to it.
This is it. This is the big question on everyone's mind, especially with schools and universities back in full swing. Any mention of meningitis is enough to send a chill down your spine. So, what's the official word?
And there you have it. That's a direct, unambiguous statement from the authorities. The Western Cape Department of Health has been really specific about this. While every single case is taken incredibly seriously, the current situation is not classified as an outbreak. The cases are sporadic, meaning they're isolated and not linked in a way that suggests there's some kind of widespread, uncontrolled transmission happening.
Okay, so if it's not an outbreak, what are the actual numbers? Let's break down the official data so we can really understand the scale of what we're looking at here.
So let's be very specific. In the first couple of months of 2026, there were 11 lab-confirmed cases in the Western Cape, and, tragically, one of those cases was fatal. Now, 11 might not sound like a huge number, but with a disease this severe, it's exactly why every single case is monitored so closely by public health officials.
To really get a handle on the situation, we need to understand the opponent. What is meningococcal disease exactly? It's a term we hear a lot, but the details are absolutely crucial for knowing what to look for. At its core, it's a bacterial infection caused by a nasty little bug called Neisseria meningitis. It's very serious, but thankfully, it's also pretty uncommon. Now, this bacteria can cause two major problems. First, meningitis, which is that swelling of the protective layers around the brain and spine. And second, septicemia, which is a life-threatening blood infection. And sometimes a person can even have both at the same time.
So how does it get from one person to another? Well, you can think of it kind of like a cold or the flu. It spreads through droplets from coughing and sneezing. But, and this is a really crucial difference, it's not nearly as contagious. You need close or prolonged contact for it to spread. This is exactly why we tend to see clusters in specific settings, places like crutches, schools, and especially university dorms. The risk is highest for two key groups, infants under the age of 1, and then teenagers and young adults, from about 15 to 24 years old. All right, now this is probably the most important part of this whole explainer. Knowing the symptoms can literally save a life, because with meningitis, every single minute counts. But the signs can be really tricky, especially in the youngest patients.
Just look at the contrast here. In older kids and adults, you get those classic symptoms we often hear about: a sudden high fever, a really bad headache, a stiff neck. But for infants, the signs are completely different and much more subtle. We're talking about things like a high-pitched cry, being unusually irritable, refusing to feed, or just being floppy and really hard to wake up. These signs can be so easily mistaken for something else. And that bulging soft spot on their head, the fontanelle, that is a critical red flag to look out for.
Now, one of the most frightening signs is the rash that can come with septicemia. It often starts as tiny little red or purple pinpricks. Here's what you do. You take a clear glass, like a drinking tumbler, and press it firmly against one of the spots. Look through the glass. If the spot disappears or fades, that's a good sign. But if you can still see the spot clearly through the glass, if it doesn't fade at all, that is a medical emergency. It means there could be bleeding under the skin, which is a hallmark of septicemia.
This quote from Dr. Smith really says it all. This isn't a wait-and-see kind of illness. If you suspect meningitis for any reason at all, you have to seek medical help immediately. Early treatment with antibiotics is the absolute key to a better outcome.
Okay, let's talk about vaccines. A lot of the recent concern on social media wasn't just about the cases themselves, it was fueled by a whole lot of confusion over vaccines. What's out there? What's free? What isn't? Let's clear that up right now. This table is so important for understanding the vaccine landscape. You see, the thing is, meningitis isn't caused by just one thing. A few different bacteria can cause it. So, on one hand, you've got the Free Public Vaccine Program, the EPI, which protects kids against two of the most common causes. But on the other hand, you have the specific meningococcal vaccines, which target that Neisseria meningitidis bacterium we've been talking about. And crucially, these are not part of the Free Public Program.
So let's look a little closer at these private vaccines. For years, we've had vaccines like Menactra, which covers 4 major strains of the bacteria, A, C, W, and Y. But the big news is the recent approval of another vaccine called Bexsero. And this is a huge deal because it protects against strain B, which happens to be the most common type causing the disease in the Western Cape right now. And just to be crystal clear, neither of these is on the free public schedule.
And here it is. This is the number that sparked so much of that online panic. The approximate cost for these private vaccines is around 1,500 Rand per dose. And some of them, like Bexsero, actually require multiple doses. This price tag, as you can imagine, puts them completely out of reach for a huge portion of the population.
So what is the official advice for preventing the spread, especially in places like schools where kids and young adults are in such close contact all the time? The public health response is actually very specific. When a case is confirmed, health officials immediately start contact tracing. Anyone who's identified as a close contact, so think family members or a roommate in a dorm, is offered a short course of preventative antibiotics. It's called prophylaxis. And this is done to wipe out any bacteria they might be carrying in their throat to stop them from getting sick or spreading it to anyone else.
All right, let's just zoom out for a moment. To understand why we're even having this conversation in 2026, we really need to look at the trend over the last few years. This graph tells a fascinating story. See that line way down at the bottom for 2021? Cases hit a historic low during the hard lockdowns of the pandemic. It makes sense, right? But ever since society has reopened, the numbers have been steadily climbing back up toward pre-pandemic levels. Some experts call this immunity debt. Less exposure during lockdown means we have less community immunity now. So, while 11 cases isn't an outbreak, it is part of a very clear upward trend that deserves our attention.
And this isn't happening in a vacuum. Health officials point out that this rise in meningococcal disease is part of a larger, more worrying trend. They call it a syndemic, where multiple health crises feed into each other. We're also seeing surges in diseases like measles, and that's being driven by a decline in routine childhood immunization rates. It's really a stark reminder that those routine clinic visits don't just protect one child, they protect the entire community.
So this is where we find ourselves. It's a complex situation. There's no official outbreak, but cases are definitely rising. We have these amazing advanced vaccines that can protect against the most common local strain, but they're only available to those who can afford them. And all of this leaves us with a final, really pressing question. How does a country bridge that massive gap between what is medically possible and what is actually accessible for every single child?